mess with your mind. And yes, perhaps with some, increase the incidence of dementias. But it can also affect your respiratory centers and cause you not to sleep as well, and your oxygen levels will drop. If your oxygen levels drop and you have central apneas or you have obstructive apneas, either one, well, that can definitely affect how you lose weight or gain weight and affect your metabolism. All those things. This gentleman had testosterone as low as well, but he came back in just 2.5 weeks, And we see all these things improve with him. I mean, his cholesterol, his triglycerides, I think, were cut in half, and his GGT, that inflammatory marker that has to do with the pancreas because the alcohol he's consuming, that came down to completely normal ranges. And he actually, his testosterone boosted up 100 points. Said this before, with guys, if they have low testosterone, almost always you can see that testosterone come up to at least 100 points by giving the body what it needs and taking away what it doesn't need. Usually going to be a dietary change. But in this case here, we see with sleep apnea, with sleep issues, what medications can affect sleep and sleep apnea. Well, of course, antidepressants. I mentioned that. Even antidepressants can make sleep apnea worse. It's affecting the mind. It's affecting the mind and potentially the respiratory centers. Also, those antihistamines can as well. So can alcohol, which is exactly what was the case in the previous patient I just brought up there. Alcohol slows down the respiratory centers. This individual started to have some mild sleep apnea. It was very mild sleep apnea. But when they cut that out, their sleep improved, their energy improved, they've lost weight, their liver enzymes changed, their cholesterol's changed, everything changes. Why is that the case? Because if it messes with your hormones, it can mess with your metabolism, right? That's an important concept for us to all understand.